Hello friends, today we are going to discuss about autism. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about neurobiology of autism, how to do assessment, treatment, and course and prognosis of autism, my dear friends. Let's understand autism spectrum disorder. It is a neurodevelopmental disorder. Sometimes it is also called as neurodiverse population. They have a classical impairment in communication, social interaction, repetitive behaviors. Here, the pathognomonic feature is they have difficulty in social reciprocity, my dear friends. Usually, it is diagnosed in the age between 3 to 6 years. Boys are 4 times more affected than the girls. 1% of the population has autism spectrum disorder, my dear friends. The triad of autism spectrum disorder is difficulty in social communication, social interaction, and rigid repetitive behaviors. Now let's understand the impact of autism. Invariably, the person with autism, they struggle to be in the mainstream education. Invariably, when they go outside, they are bullied, abused, isolated, stigmatized, discriminated. Many a time, they even been beaten up by the so-called normal people. Hence, the parents invariably do not allow them to go out. They'll become school dropout and neglected. Since they have difficulty in social communication, invariably the parents do not spend time with these kids. And the many a time they neglect because they do not get any social reciprocal emotions from these kids. Many a time they have comorbid physical condition. 85% of them will have another psychiatric disorder. And they end up without any job and no partner in life. Many a time they become lifetime dependent on parents or on the government. Many of them attempt suicide, and death by suicide is common. They have 10 to 15 years premature death compared to normal population. If they have learning difficulties or learning disability, they have premature death up to 20 years than the normal population, my dear friends. Similarly, families with autism also suffer. The parents will have guilt of giving birth to autistic child. The financial burden, which has been calculated approximately 30,000 per month in India, whereas in abroad it will be around 3 to 5,000 US dollar per month, my dear friend. Understanding the autistic child is a big challenge both for the father and mother. Many a time the parents need to recalibrate their expectation from the child. Invariably parents will have expectation that my child will become an astronomical engineer, a doctor, maybe entrepreneur, various other dreams they will have. Those dreams will be shattered. They need to recalibrate their expectation from the child. Not only that, they need to recalibrate their life because they have a person with autism in their family. Many a time, these parents will start doing doctor shopping to find the cure for this autism. They many a time, because of the challenging behavior of a person with autism, they change their house from one place to another. Many a time, the owners of this residence will check them out. They do not want the families with having mental disability or mental illness. Even if they come to know they have an autistic child, many a time they do not give their house for rent. Looking after a person with autism is a full time job. It is a 24 bar 7. Hence, the parents need to recalibrate their own dreams and aspiration because most of their time now revolves around a person with autism. Not only that, they're worried about stigma and discrimination from their own relatives, friends, sibs, family members, and society at large. Many a time, the stress of looking after a person with autism ends up with divorce. Many of the marriage break because of the person with autism. Invariably, there will be differences. Looking after a person with autism tests the marriage, my dear friends. And many a time, they start devoting their life for a person with autism, and other kids in the family will be completely neglected. Community at large also has impact. There will be economic loss because one of the parent has to look after them. Person with autism is also unable to earn their livelihood. Providing care for an autism needs resources such as special school, rehabilitation center, pension, vocational rehabilitation. Trained human resources are required to rehabilitate person with autism. At the same time, we need to educate the society. We need to make this society inclusive for person with autism. If the parents become elderly or geriatric, who will look after this person with autism? Hence, the government needs to make arrangement for residential care, hostel care. It is not so easy to shift a person with autism to a hostel if they are used to be with their routine residential place. Many a time, because of their challenging behavior, they end up with conflict with law. Many a time they get arrested. Now let's understand the neurobiology of autism. A meta-analysis published by Tick and his colleagues in 2016 with regard to genetics of autism clearly indicated that autism spectrum disorder is a heritable disorder. Although non-genetic factors also play a role. Let's look into this genetics part. In identical twins, the concordance rate is somewhere around 80%, my dear friends. With regard to non-identical twins, or called as fraternal twins, and siblings, it is around 3 to 9%. Families carrying autistic gene will have higher cluster of psychiatric diagnosis, somewhere around 20 to 35%, my dear friends. Further, inherited medical illness such as Fragile X syndrome, tuberous sclerosis, phenylketonuria tends to have autistic features, and hence multiple genes are involved in autism spectrum disorder expression with regard to gene regulation, neurogenesis, chromatin modification, synaptic function, neuronal plasticity. All these are modified because of the autistic gene. Not only that, these genes are multiple in number, my dear friends. This leads to altered behavior, development, and functioning. This points towards to overall brain underconnectivity in certain area and overconnectivity in certain area with regard to specific regions such as frontal, occipital, limbic, and cerebellum, my dear friends. Genetic studies have revealed the involvement of more than 100 genes in autism spectrum disorders, indicating heterogeneity in genetics with variable penetrance. Genetic pleiotropy are pervasive characteristic of autism genetics, my dear friends. This study by William and his colleagues, published in 2002 in Molecular Diagnosis and Therapy, summarizes the involvement of genetics and environment. All the subscribers and viewer of this video are requested to go through this important article. Further, there are hypotheses with regard to gut-brain axis, that is, faulty methylation has been implicated. Abnormal gut-brain axis leads to abnormal methylation, which is much required in DNA repair, synthesis, neurotransmitter, enzymes, and metabolism of certain metals, and cellular energy goes haywire with regard to gut-brain axis. This faulty methylation process have been involved both because of genetics and also environmental factors. Further, cerebral allergy theory has also been put forward. Persons with autisms have abnormal gastrointestinal function, leading to some abnormal enzymes or missing enzymes. This causes certain peptides to enter into the bloodstream, and further, alter the brain function. This leads to neurodevelopmental disorder, especially with regard to pruning of nerves. Hence, that this hypothesis has put forward dietary intervention, especially in autism, that is, removal of wheat and dairy products, reduces this peptide and hence reduces the symptoms of autism. Heavy metal poisoning, MMR vaccine theory, also has been put forward. With regard to MMR vaccine, the studies have clearly indicated that thimerosal content has been implicated, but that has been proved wrong. Hence, I request all my viewers not to worry about MMR vaccine. And none of the vaccines have been implicated at this point of time with regard to autism. Although in the past, MMR vaccine was considered to be one of the important trigger of autism. But now, the evidence have accumulated against the MMR vaccine causing autism. So, you need not worry about this, my dear friend. Further, autoimmune theories have been implicated. Further, environmental factors may contribute to the development of autism has been implicated. Let's discuss all those environmental factors. These environmental factors are considered as a risk factor for autism. First and the foremost, in vitro fertilization, prenatal exposure to certain pollution, prenatal exposure to chemicals, plastics, and various chemicals have been implicated. Preeclampsia, gestational diabetes, infection, late fever trimester also has been considered, metabolic conditions, obesity, paternal age, advanced maternal age, unstable trinucleotide repeats, gestational hemorrhage, causing fetal hypoxia, prenatal drug abuse, prenatal stress, maternal mental disease, maternal nutrition with regard to less folic acid, iron, and fatty acids and vitamin, interpregnancy interval is very less, prematurity and post-maturity, twin birth, suboptimal breastfeeding, birth order, familial socioeconomic status, family history of autism, infant being male gender, cesarean delivery, prenatal exposure to hypoxia, congenital anomalies, fetal respiratory distress, and postnatal complications. Various risk factors have been implicated, my dear friends. Let's understand the assessment of autism. Invariably, in primary health care, the need for screening of autism of all children is essential. The important reason is if you diagnose early, the intervention is early will lead to good outcome. Hence, a detailed clinical history in all context of functioning needs to be taken. Detailed developmental history, history of functioning outside the clinical setting, especially in the school, at home, in the society, and also outside the house. Individual profiling with regard to intellectual abilities, communication skills, adaptive skills, sensory profiling, where relevant, need to be done. And the clinician need to observe the child. Assessment of co-occurring physical conditions, neurological conditions, and mental illness need to be done. Assessment of risk such as self-harm, headbanging, challenging behavior, suicidal ideas need to be evaluated. And at the same time, there are no biological tests which positively diagnose autism. However, MRI and EEG should be done with regard to rule out organic conditions and also various other genetic disorders. And impact of autism on child and also on the family needs to be evaluated. That is a very essential because we need to rehabilitate the child within the family context. Family assessment, IQ assessment of the child, SLD assessment of the child may be required. Various screening assessment scales are available. Screening tool such as autism in toddlers and young children need to be done. If required, autism diagnostic observation schedule, autism diagnostic interview revise schedule, diagnostic interest instrument for social communication disorders, childhood autism rating scale, CARS, social responsive scale, and social communication questionnaire. These are the various assessment scales which are available. Some of them are copyrighted. Do we require all these skills? Not required. A good clinician who is working in autism can diagnose without all these skills. A new clinician, especially pediatrician who have never been trained with autism, may require these tools. However, the psychiatrist who have been posted in child psychiatry for more than 3 months can diagnose autism without difficulties. However, a milder autism in adult, which are first time to be diagnosed, is a challenge for any clinician. What is the gold standard in diagnosis of autism? The gold standard is clinical evaluation. As I mentioned earlier, there is no blood test or X-ray or CT scan, MRI to diagnose autism. It is only the clinical evaluation by a psychiatrist or a pediatrician. We need to take multiple information from various family members, teachers, and relatives. Developmental history should be precise. Presentation of symptoms in multiple contexts and functioning of the child to be done. Observation of the child, if required, assessment scales, and multiple settings may be required, especially in mild autism. Although I am mentioning all these scales and procedure, these are required for a new clinician. For a clinician who is seasoned, who has experience, can diagnose autism within a matter of 5 to 10 minutes. Let's discuss about the treatment of autism. The treatment of autism starts with comprehensive evaluation and positively diagnosing the autism. Once the autism is diagnosed, we need to engage the parents by educating them about autism. We need to break the myths of autism because the parents will be devastated when they come to know their child is suffering from autism. But in a country like India, the parents' involvement is essential in rehabilitation. Hence, we need to refer the parents to the self-help groups if they are available. We need to identify the comorbidity, especially neurological comorbidity like epilepsy, psychiatric comorbidity such as ADHD, anxiety, depression need to be recognized and treated aggressively. Educate the parents not to fall for the trap of autism cure advertisements. There are many thugs in the society. They will say, we will give cure to your children and they will take huge amount of money. Don't fall this prey. One of the commonest of late is stem cell therapy. And they offer somewhere around 5 to 10 lakh rupees per setting. And they will do multiple setting telling that this stem cell therapy did not work. Let's have one more setting. And they will completely drain the resources of the family members. What is the current understanding? Autism and stem cell therapy, it is still in research. There are no evidence to say stem cell therapy will completely cure autism. Hence, recently, National Medical Commission of India recommended against the use of stem cell therapy for autism. And if any doctor is involved, especially allopathy doctor, if they're involved in stem cell therapy, it will be considered as professional misconduct, my dear friends. And this was published in January 9, 2023. Not only that, even ICMR, Indian Council of Medical Research, clearly reported that stem cell therapy is unethical, my dear friends. Hence, never ever advocate stem cell therapy for autism. So, my dear friends, again I am repeating, stem cell therapy is not recommended in autism. So, what is the answer for autism, my dear friends? First and the foremost is parental awareness and education is the key in the management of autism. We need to treat the comorbid condition such as epilepsy, anxiety, depression need to be addressed immediately. We need to refer the child for speech therapy if the child has language and speech problem. Self-help groups need to be identified and the parents need to be referred there. You need to maintain the ritual of the child so that the challenging behavior can be reduced. Sleep hygiene should be maintained. Environmental analysis of the family and the child to be done. And there are various therapies. And there are more than 28 different therapies have been identified. I am mentioning some of the therapies. These range of interventions have been identified with regard to treatment of autism spectrum disorder. Based upon the functionality and deficit, you can choose these therapies. Some of them are applied behavioral analysis, daily life therapy, Miller method therapy, relationship developmental intervention, developmental individual differences relation based intervention, treatment and education of autistic and related communication handicapped children. Let's discuss each one of them. First one is applied behavioral analysis. This is it's basically developing procedure which will produce observable changes in behavior. This is applied psychological sciences. In this, ABC analysis is done. That is antecedent. What's come before a specific challenging behavior? What is the behavior itself? And C is consequences, what happens after the behavior. Based upon the learning principles such as classical conditioning, operant conditioning, and learning theory or social learning theory, based upon that, applied behavior analysis is done. The next one is daily life therapy. That was advocated from Japan. It is a structured educational program with a holistic approach focusing on heart-to-heart therapy or education using three fundamental pillars. One is physical stamina building, emotional stability, and intellectual stimulation. These provide many opportunities for growth, be it through body awareness, self-control, social development, mood stabilization, or academic achievement. This daily life therapy is a 24/7, and this therapy occurs in an institution. Let's look into the Miller method. Miller method was given by Arnold and Eileen Miller. The Miller method uses two major strategies to help the children with autism and severe learning disability. Here, they endeavor to help the child for their fullest potential. The transformation of children's aberrant system into functional behavior is the main focus, and systematic and repetitive introduction of developmental relevant activities involving objects and people are the focus. The philosophy is every child, no matter how withdrawn or disorganized, is trying to find a way to cope with the world. Under this philosophy, they will help the child and the family. The fourth one is relationship developmental intervention. A parent is the principal therapist here. The parent led approach that focuses on helping the autistic children to develop a dynamic intelligence. What is this dynamic intelligence? It is a social skills, thinking flexibly, understanding different perspectives, learning to engage and form a close relationship with others are the focus of relationship developmental intervention. Here, the parents learn these principles, undergo training, and the therapist guided implementation occurs on daily basis. Minimum 4 to 5 hours is required daily so that the improvement can be seen. The fifth one is developmental individual differences relationship based intervention called as DIR, which was given by Dr. Stanley Greenspan. It is also called as floor time. It is based on the developmental theory that says that all children need to reach certain milestones so that they can keep developing emotionally and intellectually. It is based on three core components. They are functional emotional developmental capacities, individual processing differences, and relationship and interactions. Sixth one is TEACCH therapy, treatment and education of autistic and related communication handicapped children. Autism is caused by differences in the way people brain work, and TEACCH works on the key idea of leveraging the child's strength and working around the areas of challenge. TEACCH method relies on the five basic principles: physical structure, scheduling, work system, routine, and visual structure. Along with this, autism spectrum disorder also has various other therapies such as social communication emotional regulation, transactional support model, music therapy, sensory integration therapy. Now, which is the best therapy? There are various systematic reviews have been conducted on intervention in autism. Unfortunately, there are few studies. One of the recently conducted systematic review published by Hume and his colleagues in Journal of Autism and Developmental Disorder, my dear friends. This is the intervention based review. This review study had two parts. The first part are the review from 1990 to 2011, which included 427 studies, my dear friend. 2012 to 2017 is the second part, which included 545 studies. Totally 972 articles were included in this review. Let's look into how the articles are divided. Here again, the number of articles you can see improved or increased exponentially from 2011. What are the characteristics of this study? 83% are case reports, single case design studies, my dear friend. Group studies are hardly 17%. RCTs are 13% only. That means evidence based is very poor. 79% of the studies were conducted in individual sessions and 14% in the group setting. 48% are conducted in educational institutions or in the universities. Clinic based is hardly 20%, home based is 18%, and community based is 13% only, my dear friends. But there are huge limitations of these interventions conducted in autism. Most of them are heterogeneous population. Setting of the studies are different. Diagnoses are not uniform. Age of the children varied significantly. Varying diagnostic criteria, varying scales. Interventions were not uniform. None of them were manualized. Sessions were varying in number. Involvement of parents, caregivers, duration and follow-up were different. Case reports were common. There are hardly few RCTs. No blinding of the raters were done. Small sample size. Retrospective designs were common. And outcome criteria were not uniform. But however, this study concluded with few important observations. 28 different therapies were recognized, and 10 of them were manualized therapies were noted. And they clearly reported, by assembling all these therapies and manualized therapies, you need to tailor the need for each individual patient, my dear friends. There is no gold standard treatment available for all autistic children. Based upon the children's need, based upon the deficit, based upon the functionality, based upon the available resources, we need to choose the therapies, my dear friends. There are various other non-specific interventions, such as the requirement of special schools or not, whether we need to do group therapy or individual therapy, home-based education, or normal schools need to be done, whether one-to-one teacher is required or not. Diet therapy has been indicated, whereas this diet therapy involves removing wheat and dairy products. Good nutrition is essential because children with autism will have very narrow repertoire of food and they will insist the same food. This leads to loss of nutrition. Various vitamins are lost, minerals are lost. Hence, we need to have a good nutritional support and dietitian support. We need to identify food sensitivity and remove them from their diet. Disability pension is required. And at this point of time, advocacy with regard to autism, and we need to accept the way the person with autism is there. We need to encourage them to make friends, involve them in the group. We need to involve them at their terms and uniqueness. We need to stop bullying them. Do not force them to be part or to change them. Let them be the way they are unique. We need to accommodate their uniqueness. And we need to have inclusive education, workplace, and society, my dear friends. Let's understand the course and outcome of these autism. Autism is treatable and it is a lifelong condition, my dear friend. It is a developmental disorder and also it is considered as a developmental neurodiversity, my dear friends. And invariably, person with autism has less than 15 years of lifespan when compared to normal population. Person with autism have fourfold increase in death by suicide when compared to general population. Presence of comorbidity adds to poor outcome. The most important prognostic factors are IQ, the degree of social interaction impairment, lack of appropriate communication leads to poor outcome. Early intervention has a good outcome, my dear friends. Let's critique the autism. Many of the researchers, people with autism community, believe that it is a neurodiversity rather than a developmental disorder. If they are a diverse population, we need to accept them. And why we need to treat them then? Since it is not a disorder, we need to involve them in the normal schools. Many a time, clinicians feel that it is a disorder, but various activists feel that it is a normal variant. If they are normal variant, why need to give them a special education? It is the question has been asked by various physicians. Many of them say autism doesn't require any medication. Unfortunately, 85% of the person with autism have comorbid physical or mental disorder. Hence, many of them require medication and therapy, my dear friends. If it is normal, why do they require therapy? Why do they require intense training is the question we need to ask. But people with autism have been cared, at the same time have been supported by the mental health professionals, including psychiatrists. There is no cure at this point of time. Chasing the cure is a dream, my dear friend. At this point of time, the need is a remedy, inclusive society. By telling that it is not a disorder and telling them that they are different in the society is very difficult to accommodate. The society accommodates a person with illness rather than having abnormal behavior. If you say it is not a disorder, then how can a disability certificate can be given to them is a big question, my dear friends. To conclude, we need to screen every child for autism at the age of 12, 18 and 24. Clinical assessment is the gold standard in the diagnosis of autism. There are no lab investigation positively to diagnose autism, but however, lab investigations are required to rule out various organicities. At this point of time, there is no cure for autism, but there is a training available to decrease their impairment and making them to be able and functional in this society. Parental education and engaging the parents is the important indicator for a good outcome. Medications are required in comorbid conditions. We need to keep the child in the mainstream rather than putting them in a special education. Unless the child requires special education, we need to accommodate them in the normal school. We need to educate other kids and other parents with regard to autism. There are basket of therapies are available. Based upon the child's need, we need to involve those therapies. Individualize the treatment planning. Unfortunately, countries like India has very few therapists at this point of time. We need to interact and include persons with autism with regard to availability of treatment and availability of inclusion in the society. They are unique human beings at this point of time with a different ability need to be understood. Inclusive policy is the need of our at this point of time. We all need to embrace their diversity with regard to neurodevelopmental impairment or else functionality. And this is an important point, my dear friends. Thank you very much for giving your valuable time. Stay safe.